As the coronavirus continues to spread across the country and around the world, so do anxieties about the illness. Since shelter-at-home orders went into place, some therapists have shifted to e-counseling platforms, and that does include Samaritan Counseling Center. Chris Taylor joins us virtually live this morning. Thank you so much for joining us right here on East Texas Live.
Thank you for having me.
Absolutely. It's our pleasure, Chris. So if you can, tell us, what are the main reasons why people are so stressed out during this coronavirus outbreak?
Well, I think fear and general anxieties are peaked during a time when we don't have a lot of information, or there's misinformation, or some information is used to scare people, and that sort of thing can peak anxieties in the general population. But for those that suffer with anxiety, depression, or coping challenges, it can be extremely stressful for them, even more so.
Absolutely. This uncertainty, a lot of people just can't really handle it or don't know what to do. So what advice can you offer to East Texans to stay mentally well and mentally healthy during this pandemic?
Sure. I think, as the CDC and others would recommend, good sleeping, healthy eating, physical activity, connecting with your family, your friends, and your community, using technology are always pieces of sound advice. Our therapists teach self-care, which is really focusing on your needs while you're focusing on the needs of those around you. We can't get into a position where we're caring for others so much that we forget ourselves. So that really is important, to focus on what our body, our mind, and our spirit are telling us that we need in the moment.
I'm glad you mentioned self-care. So can you give a few healthy examples of what that might look like? Is it a simple bubble bath? Is it a nap? What are we talking about here?
For some of us, it could be letting Calgon take us away, but for most of us, though, it's taking a moment to be mindful of where we are. We can do that while we're eating. Sometimes we eat so fast that we don't even know what we ate or how much we ate. So a mindfulness exercise might be simply taking a bite and putting your fork or your spoon down and trying to figure out the ingredients of what you're eating. It brings you into the present moment. So that's a good self-care tip. And also just making sure that as you're taking care of others, we forget to eat, we forget to go out and exercise, we forget to do things that we love. So we really need to focus on that.
Now, Chris, tell me, if you can, what you are offering to our frontline essential workers that are still on the clock out in our communities right now.
Absolutely. We have a variety of things available. We launched e-counseling last year, so we can be available. And currently we're serving all 35 counties of Northeast Texas via the video platform. We are doing in-person counseling again now that the shelter-in-place orders have lifted for those clients that it's necessary. But we also, the staff sat down and thought of a way to try to reach our frontline employees, such as healthcare workers, with what we're calling an acute stress care program. And essentially what it is it's kind of a happy medium. So instead of an hour-long session, you would get a 25-minute time with a licensed professional so that you could focus on the acute stress you're in. We've seen physicians in New York, one notable physician who committed suicide as a result of having to deal with COVID patients. And just the sheer humanity of it all can bring even the average person without a mental illness to their knees sometimes. So this program is intended to deliver some specific skills to the person, to ground them, to identify their resources, and leave them with coping mechanisms for that acute stress. And so we're offering that now as sort of a medium between a full session and having nothing at all.
It's really amazing for y'all to step up. Where can people learn more about this or seek help from your counseling center?
Easiest place is to call us at our main phone number, 903-593-9141, and simply ask about the acute stress program, or they can visit our website at sccet.org and find more information there.
Chris, thank you so much for joining us this morning.
Thank you.